Well, Laura, thank you for your question. I believe that every citizen should have access to quality and affordable health care as a right of citizenship. And that's been my position since the day I was first elected to the Congress. As a result of that belief, my wife and I have refused to accept any government subsidy for our health insurance. I think if more people in political office were faced with paying the full cost of health care, they would perhaps have a better understanding of what many people like you and others across Ohio are facing. The sad fact is that about 1.3 million Ohioans have no access to health care. And your question was a good question regarding pre-existing conditions, because the practice has been in the past that the insurance companies during the open enrollment period would make it possible for people with pre-existing conditions to enroll, but they would charge them 4 or 5 or 6 times the normal rate for that coverage, in effect basically making it unaffordable. And what we have just recently done with legislation that I introduced and we got passed, we're trying to put a cap on the amount that can be charged to those with pre-existing conditions. And eventually we want it to be law that in Ohio an insurance company can charge a person with a pre-existing condition no more than 1 1/2 times they charge the lowest rate for a person with a non-pre-existing condition. We believe this will open up affordable health insurance for perhaps hundreds of thousands of people. But the ultimate solution to health care is to have a federal plan that will be all-inclusive and comprehensive, and make sure that no American and no Ohioan will ever have to go without needed health care simply because they have a pre-existing condition, or because the insurance companies denies them care, or because they simply do not have the resources necessary to pay for that insurance. That's what I hope happens in Washington. But in the meantime, Laura, we're going to do everything we can here in Ohio within the constraints that we have to expand health care coverage for more and more people. Thank you for your very thoughtful question, and I wish you the best.